in this time period where you had a biopsy, you um, were doing your testing for your stat genes, what was your mindset about the expanded panel? Were you excited to do that, or was there a little hesitation on that?
There was a lot of hesitation. The stat was no-brainer to me, like, "Okay, definitely, do it." But I had to talk to my husband about it, and we just really talked it through, like, this would be scary to know, and as we talked, we finally kind of came to the conclusion that look back at was an obvious decision, but power is knowledge. And if there's a chance that I have a genetic variation that is actionable, why wouldn't I want to know? Because the whole thing with cancer is catch it early or prevent it. And so, I look back at that whole time and my poor husband, because this was actually something as I was thinking about this podcast that I didn't very think through very well because I had already made up my mind in 2008 that if I ever was told I had breast cancer, I was going to get a double mastectomy. When I was diagnosed, I literally called my husband and was like, "Jim, well, it's cancer and I'm having a double mastectomy." And I had convinced him just like I had convinced myself that it was a cyst. So he was completely flabbergasted
Yeah.
and scared and way more. And I look back at it now and I wish I had had a little more sensitivity to what it was like for him, but I was so glad that I had him as a partner to think through, do I wanna know this big panel? And yeah, so I did end up doing it, and I'm very glad I did because I did have something that popped up.
So, okay, let's stay there for a while, because what I found that's interesting, and you shared your stories on many different platforms, including the Today Show, today.com online, and you talked about the trepidation you had for doing the larger panel. Do I really want to know? But it speaks to the importance of our support circle, whether it's a loved one or a trusted individual, to air out those things, air out those fears, and help us to advocate for ourselves, have conversations with our care providers. And I also want to point out too that there are many patients in that same position of being diagnosed that are not counseled or sent out to a genetic counselor for counseling, because many clinicians may know of BRCA, but they don't know about like multi genes or the many other genes that could make a patient high risk. So, what did you understand about the smaller single gene or a stat versus the comprehensive panel back then? What did you learn that made you go through with the comprehensive gene panel?
Well, I guess, Doctor Google. I just got I got on the internet and was trying to understand what was on the panel, what they might mean. I Beyond my mom, and this was the main thing, is beyond my mom, we do have other cancers in my family. Her dad had colon cancer, for instance, and her sister has had breast cancer, and my dad's mom had breast cancer. So I knew that there were some funny things going on in my family, and it just made sense to know. And if, like I said before, if there's something that I can learn where I can take some action to prevent or catch something early, it just made sense. Um,
Yeah.
yeah. So I did meet with a genetic counselor. So that was part of my my journey was meeting with a genetic counselor, and she once I got the results. So I don't know if you want to jump into that yet or not.
Well, I mean, yeah, let's jump into it, because I think it's important that you got genetic counseling early. A lot of times that may be, put off until certain treatments are made, but it can have significant implications, therapy implications. But also, as you mentioned, as you're going through it, it gives you an opportunity to talk with your family about the results of those and how it may impact their health care long term. So let's talk about the results and kind of what drove your decisions for care.
So when the panel came back, I had a positive in a gene that's called PMS2. It's tied to Lynch syndrome. I had never heard of any of this at the time. Met with a genetic counselor and learned that I had an increased chance of cancer in colon cancer, which made sense with my grandfather having it, ovarian, uterine, stomach, bladder, all these things. And so she recommended that I consult with what is she called? Gynonc,
Mhm.
a
Gynecologic
gynecologic
oncologist, yeah.
oncologist. And I met with her, and she recommended that I have a total prophylactic hysterectomy. I was finished having children, and to me, I was like, "Well, I don't need these organs anymore, so let's get them out." And so, yeah, so over the course of 2 years, I had 5 surgeries between a mastectomy and reconstruction and a total hysterectomy and some issues all in there. Yeah, I had 5 surgeries, so I personally feel like I mean, some people would say 5 surgeries is horrible, but I feel like I got off easy because I did not have to we did catch it early enough. I did not have to do chemo. I did not have to do radiation. So I feel very blessed that that was yeah, that was part of my story too. Um, kind of feel guilty when I talk about being a breast cancer survivor because we we did catch it so early, and I really to me 5 surgeries is nothing compared to that other stuff. So